So in the arterial space, I think one of the critical issues, and not to make a pun, is critical limb ischemia. We just are finding more and more patients that have this limb-threatening ischemic episodes, and yet we don't have the clear pathway for treating these people defined at this point, whether it's, and as we have mentioned earlier, what are the outcomes that we really want to follow, what kind of devices, what interventions, what medical management of these patients. So to me, that's really kind of probably the biggest issue that we're facing right now in the arterial space.
Also potentially what metrics do we assess?
Yes.
Is it wound healing or amputation prevention, or what matters for the patients?
What the outcomes are.
Yeah.
Yeah.
In terms of the venous world, the constant struggle, I mean, there are multiple, controversial issues. When do you put filters in? Do you put filters in at all? Then the pendulum swung the other way of remove the indication of filter being presence of one. You remember that? See, I remember his slide. So does every filter
indication for removal?
Yeah, indication
right,
for removal is the presence of an IVC filter, is what some are trying to preach, if you would. So at what stage, do you get some sort of semblance and a more of a educated guess as to how to deal with these patients? Same thing with, the deep venous interventionalists want to fix the deep venous obstruction first, and the superficial venous interventionalists want to fix the reflux first for venous issues. So how do you do the timing of this? Plus, what about health economics? So these are still unanswered questions that we need answers for.
In the arterial space, probably one of the most exciting and interesting ones is going to be the Voyager PAD trial. So it's not an intervention trial per se, it's the management after intervention, comparing rivaroxaban with or after intervention. They all get aspirin, and so we're thinking that's going to be a pretty interesting and impactful trial. And I think we're open to the idea that medical management is going to become much more important over time and may diminish the need for the interventions. Again,
or re-interventions.
So re-interventions. The whole point of VIVA is the care of vascular patients as a global thing. So that, I think, to us will be very interesting. Best CLI trial will hopefully complete enrollment, so we probably won't see the results, but at least to see it completed in 19 will give us at least then the anticipation of a comparison of two major forms of intervention for critical limb ischemia. The Boston trial of below-knee drug-eluting stents in the tibials, very tough area for us to work in, and thinking that maybe we'll be seeing something coming from there as well. So a lot of interesting things happening and a lot of stuff to be looking forward to.
In the venous world, venous stent trials, they're nearing completion. There are several completed. Arbre trial will be completed by end of this year, hopefully, and results will be published in 2019.
I'd put a plug in for filters.
Yes.
The Preserve
Yes.
trial will
Preserve
complete.
trial, yes.
We probably won't be getting data, but hopefully it'll complete. And the Cook Civic trial potentially we'll be seeing. I know they're completed, but hopefully we'll see some data at some point. So begin to get some clarity on vena cava filters as well.
And most likely we'll have more information on the thrombectomy devices too, don't you think?
Yeah.
By 2019. After the ATTRACT trial, the whole focus is now driven to treatment of pulmonary embolism and DVT without lytic therapy. So, the thrombectomy devices have started their clinical trials, so hopefully, even though they're going to be single-arm studies, they should come out in 2019 too.
Yeah, definitely an area of increased interest of everybody treating these patients.
Yeah.
So it'd be great to have that data.